Right. Thank you very much, Emma. We are so pleased to be here today, and Dr. Wentz has been wonderfully instrumental in building this partnership, not only with our organization, but linking all of the case students, whether you're medicine, nursing, or social work, into our Northeast Ohio Outreach and Enrollment Council. And so, as she was mentioning, we have a whole bunch of organizations working on these shared initiatives. But today what we're going to talk a little bit about is just some of the basics of the Affordable Care Act. So you have a solid understanding when you're having the first conversation with consumers at an outreach event. If we can advance. Okay, so with the Affordable Care Act, obviously it passed in 2010, was upheld by the Supreme Court in 2012. And one of the key tenets of the Affordable Care Act is something called the individual mandate, which basically means that anybody in the United States must have some type of health care coverage. You can get your health care coverage through your employer, which is a lot of times the most common way that people have gotten insurance in the past. You can sign up for Medicare if you're over 65. You can qualify for Medicaid if your income is low enough. And now we have this new product called the Health Insurance Marketplace. And so these are all of the things that different individuals may come to you and say, I don't know if I have insurance. They might mention, well, I have CareSource. What you'll learn as you talk with our navigators is CareSource is one of the managed care entities for the state of Ohio. And so that means they fall into the Medicaid bucket. And this is one of those systems where as you start to learn the different organizations and names, you know, we can give it to you on a handout, but then you'll start having those conversations with consumers and you'll know a little bit more about how people in the community actually get their coverage and then how they use their coverage in the community. And there are a few exemptions to the individual mandate. Definitely one of the biggest things that we see is people who qualify for the hardship exemption. And then in this community, we also deal with sometimes undocumented immigrants that can't qualify for anything because they're not a legal resident here of the United States, and so they can't qualify for something that's sponsored by the government. And both Medicaid and the Marketplace are government-sponsored programs. And so what we do with them is we actually have our local access plan that allows us to connect those folks still to our local health care system through the federally qualified health centers and our local hospitals. So that'll be one of the other important pieces for you to know as you're talking with people, that regardless of what situation someone presents to you, you will know if you can fit them into Medicaid or the Marketplace. If they're old enough to qualify for Medicare, we can direct them to somebody who can assist. And if they don't qualify for any of those pieces, we can still help them. So that's one of the biggest things, is that as you're talking to a consumer, especially if you feel that they are extremely disadvantaged and are feeling like the deck is just completely stacked against them, we want everybody engaged in the outreach component to be able to say, wait, don't stress, we might have a solution for you. Let's sit down and have a conversation so that we can work through your situation in a one-on-one environment.